Welcome back to Prime Morning, and it's Good Living segment time. And today's conversation, we are talking childhood cancers. Now, WHO reported that each year an estimated 400,000 children between the ages of 0 to 19, so child and adolescents 0 to 19 years, develop cancer every single year. An estimated 400,000 children. This is really heartbreaking to know. But what do we know about these cancers? What are the most common types? How can they be prevented? What can be done to contain them? You know, there's this notion that cancer only affects people who are abroad, or people who have lived, who go, you know, outside the country and come back into the country. So if you're somebody who was born and bred right here in Ghana, there's no way you can get cancer. But hey, please, no, it's not true. It really isn't true. Today we are going to talk childhood cancers, and then how best we can prevent childhood cancers. And so get your notepads ready, get your pens, get your notebooks ready. If you have any questions at all, make sure that you get interactive with us on our social media platforms. So my guest for today's discussion is Dr. Nanaya Bonney, who is a pediatric oncology fellow at the KBTH Hospital and is on the Paediatric Society of Ghana as well. Good morning, Doc.
Good morning.
How are you?
Fine, thank you.
Yeah, I'm not supposed to be smiling because of the conversation that we are having, because you know,
I know.
Childhood cancer, it's really heartbreaking to know that children can also be affected, you know, with cancer. You hear cancer and then you feel like, oh, it's only adults who can get cancer of any parts of the body, but then children are also prone to these. And so viewers, like I mentioned, we are going to talk about the most common types, so get ready, and you can get interactive with us on our social media platforms on all Facebook, Instagram, Twitter. You can send in your questions. The phone lines will be opened at some point, and then you can call in and ask your questions as well. And all. Doc, let's get started. What is childhood cancer? Okay. Is there anything like childhood cancer?
Yes, please, okay. There is. So I'm glad you mentioned the WHO statistics that as young as from 0, that means that right when the child is born, the child can actually have cancer all the way to the teenage age or to the adolescent age. Right. So indeed, there's something known as childhood cancer. And I mean, we have living testimonies of people who have childhood cancer right here in KBTH Hospital. So it's really prevalent amongst us, and we need to make a lot of noise about it. Now, even from the same WHO statistics, it's estimated using the Ghana demographic survey that for Ghana we should have an estimated number of about 1,500 children diagnosed with cancer every year. But then that is not what, but that is not what we see, because per the projection, every 1 in 500 children, or every 1 in 500 child is supposed to have cancer or supposed to be diagnosed with childhood cancer. But then for Ghana, we don't see that in our hospitals, because out of the 1,500 that we estimate to be having every year, we only see about 300 in our facilities. So in Kolebu, we get about 150, 180 in a year, and then Konfanoche, which is another.
It's supposed to be more.
So that means that we have a lot. Yes, we have a lot of them not presenting to us in the hospital. So let me just zoom into what is cancer. So for the normal human being, when you are delivered, you are supposed to grow, and then when you grow, you age, and then you die. And that is what happens in our body. The tiniest part of the body is known as a cell. So the cell will grow. You have a lot of cells coming together to form the tissue, then it forms the organs. The organs are the liver, the heart, the kidneys in our body, and then they come together and then they form the human body. So this cell undergoes something we call a cell cycle, and then once it undergoes a cell cycle, it will grow, it will divide, and then it's supposed to die. Now, if the ability of the cell to die is lost, then it means that the cell will just keep on growing. And when it grows out of proportion and out of control. And that is what results in cancer. So cancer is when the body loses its ability to control cell death. And then you just have the cells growing in any direction, in any proportion, and then they just grow and then they spread and then they cause havoc to the cell or to the body.
So it can be any part of the body at all?
It can grow in any part of the body. So that means that we have different types of cancer affecting different parts of the body. So in children, the common cancers that we have what we call the acute leukemias, and that is blood cancer. So that affects the blood in the child, and usually for acute leukemia, blood is produced in a part of the body known as the bone marrow. So that is where you have the blood cells being produced. There are different types of cells that make up the blood. We have the red blood cell that gives the color, and that is what carries oxygen. We have the white blood cells that protects us from infection, and then we have the platelets that when you have a cut, it prevents a clot. So that is where you have the cells being produced. So you can have cancer seeding there, and then it means that all these cells I've spoken about will be affected. Yes, they will actually be affected. So the child can present with very low blood level, and then we'll say that the child is anemic. The child may have a high temperature, and they will be prone to infection because the white blood cells that are supposed to protect the body from infection, it's not functioning or it's not being produced in the right quantity and then in the right form. Okay, so that is blood cancer, so acute leukemia. And then we have the cancer that also affects the kidneys. So that is called...
In a child?
Yes, please.
Wow.
It can affect the kidneys. So we have what we call Wilms tumor or nephroblastoma. It's also one of the common cancers that we see. Then we have something we call lymphoma. So there are certain tiny swellings that sometimes when you get an infection, you realize that they get swollen up. We call them lymph nodes. So you can have cancer seeding in those places, and then they are termed as a lymphoma. Then very commonly in very young ages, sometimes they are even born with it, is the eye cancer, which we call retinoblastoma. Yes, so you can have that also being present in children. Then we have the bone cancers, which usually affects those in the growing ages, the adolescents. It's called osteosarcoma, so that also can present. Then another type of cancer is the brain cancers. They have varied names, so you can have CNS cancers, so there are quite a number of them. Yes.
So earlier you mentioned that, you know, in Ghana, what should be expected with the number of cases for childhood cancer is around 1,500.
Yes,
per year. But here's a situation where you are recording less than that.
Far less, please.
Far less.
Yes.
So like 150.
So 150, 180 is what we see in Kolebu.
Okay.
But in Kofanochi, they also say about 130. So if you are putting that together, it will be about 300 for the two major, for the two major health centers that we have in Ghana.
Right. So with the cases that you've recorded in these two hospitals so far, what type of cancer or childhood cancer is the most common? So
I'll say that there are two common ones among the lots. So that is the acute leukemias and then the lymphomas. Those are the two that we see very, very often. Yes, please.
What causes these? I want us to talk about that.
Yes, please. So for causes, I'll say that in childhood cancer, unlike in adults where you say that there is a direct correlation or a direct risk factor, for childhood cancer, it's not so. You know, in adults, you say that when someone smokes, the person is predisposed to having lung cancer.
Yes.
But in children, cancer can just happen spontaneously.
How?
There is...
Why?
So there is very little control that anybody can have over it. So the main thing is you can have something we call genetic abnormalities or genetic mutations. So the genes that make up our body, that is what we inherit from our parents. You can just have a spontaneous change happening in it. It can just happen. So the common cause is really unknown. that being said, there are very few infections that can be implicated in childhood cancer. One is HIV/AIDS. The other one is hepatitis B and hepatitis C. So they can actually be associated with the lymphomas. So they can, a child who may have HIV from the mother could actually have a lymphoma. Sometimes too, when they are exposed to radiation, so in areas where, or in places, let me say outside Ghana, in the developed areas where you have nuclear bombs and all that, so the explosives, the fallout from it, the patients could be exposed to these radiations and they are prone to developing cancer. Yes, please.
With these cases that you record, what are the mortal rates per year? I'm interested in that.
Yes, please. Okay. So one of the driving force in us actually making so much noise and then creating a lot of awareness about childhood cancer is the fact that we want people to present early. When you present early, then it means that we are able to cure the cancer. If you are not able to present early, then that is where the mortality results.
So with the two that you mentioned, when they are detected early, they are curable?
Yes, please. So childhood cancer is curable when detected early. And then when you present early, so the presentation early is very important. I mean, the two sort of go in hand. So you need people to be aware that these are some of the signs I need to pick up and then present early when I pick it up in a child. And then when they come, we also try to diagnose it as quickly as we can, and then we start the treatment, and it's curable. We have people who have been cured and are in the university, people are married.
Wow.
Yes, it's very heartwarming to know. And I mean, you just know that when you come early, we can actually save the child's life. But then unfortunately, when you don't present early, then you can have them dying. Because at that time, what cancer can do is that it can spread. And when it spreads, sometimes it's very difficult to treat. And then there is very little that anybody can do.
Let's come to the early detection, the symptoms that you can look out for. Okay,
so there's an acronym that we've coined that we say it's the Siluan sign. So Siluan, so S-I-L-U-A-N.
Okay.
So the S stands for seek medical help early. So once you find anything abnormal on your child, you should seek medical help. And then the I goes with eye, so your eye. So if you find anything abnormal in the eye, usually there's a whitish spot which we call leukocoria, and that is one of the signs that could actually point to a retinoblastoma, the eye cancer. So if you see any whitish spots in the child's eye, it is not normal. Some people see it to be nice or pretty. In the evening when light shines on it, it sparkles like a cat's eye. So another name is cat's eye. So that is abnormal.
It's abnormal.
Yes, please. If a child is not able to see well, so sometimes you realize that the child is looking in a different direction and the eye is moving in a different direction, that is what we call a squint. So that is also abnormal.
A squint, as in you're talking alukumi?
Yes, please, alukumi. That's what the local thing that we say. So that is not normal.
So the English is?
A squint.
A squint.
Yeah, so it squints.
Squints.
Yes, please.
Okay.
We say that the child has a squint.
So please, let's stop saying alukumi, alukumi. It's squints.
Oh, the other medical term is strabismus.
Strabismus?
No, strabismus.
Strabismus.
Yes, please.
Oh, wow. So either squint or strabismus.
Yes, please. So that is also abnormal. If you see that the eye is bulging out, we say that it's proptosed. So there's a swelling, or the eye is actually swollen and it's pushing out. It is abnormal. You're not supposed to stay at home and say that there's nothing wrong with your child. Why do you look so surprised?
No, because maybe there's some people who actually have the
no, so
eyes.
that is different. That
I mean, like in children.
Yes, so you can actually see an obvious bulge and the eye is swollen. So it will surprise you to know sometimes when they come, it's very it's very unsightly because they come and it's bulging, it's protruding out and it's discharging fluid and all that because it's infected. Yes.
Okay.
So people it will amaze you to know people actually sit at home and wait for that long before coming. So that is also abnormal. If you see that the eye is reddened, please kindly seek help. So if you have all these signs, that points to the eye. That means it's the eye. There's a problem with the eye.
You need to get it checked.
Yes, please. Then L stands for lumps. So if you have any swelling, so it could be a swelling on the head, a swelling around the chin, around the neck, sometimes swelling in the abdomen. So in our abdomen, we have the various organs, the liver, the spleen, the kidney. You see someone's abdomen actually protruded out, very huge, and then they are sitting at home. So that is not normal. Sometimes we say that maybe the child has eaten so much and the child is full. No. If you see that, please, yes, people give a lot of reasons for all these presentations. So please come to the hospital. It is not normal. Then U. So the U is unexplained fever for 2 weeks or more. So if you are home, your child keeps on having a temperature, you've been buying paracetamol from the pharmacy, it's not resolving, please come to the hospital. It may not be normal, so you need to present. So unexplained fever, if the child has any unexplained pain, unexplained weight loss. So sometimes you are there, child is eating or probably not even eating well, it just keeps on losing weight. It is not normal. Please come to the hospital for us to attend to the child. Then we have the A. So A is aches. So one of the common presentation for acute leukemia is bone pain or bone ache. Okay. So it's one of the common things that they can actually have. So if they are complaining of pain in the limbs, any parts of the body, please don't stay at home. Kindly bring them to the hospital. Then the last one is N. So N stands for neurological signs. So if there's any change in behavior in the child, the walk, that will be pointing to a brain cancer. So the walk, maybe the child is not able to walk well, there's an unsteady gait, it is not normal. Sometimes they may even have convulsions, what we call seizures. It is not normal. Kindly do not stay at home. You need to seek help early. Yes, please.
So is there a possibility that maybe the kind of lifestyle that parents or guardians are training or, you know, bringing up their children could be contributing to these things? And then what could they be and how can it be prevented? Okay, so far, there's been no study to sort of directly link, let's say, any particular food to cancer, or saying that maybe if the child is having more screen time, it could cause cancer. No. But then the main thing is that it is spontaneous. It can be genes inherited from the parents, and then some of the few infections that I stated. So no particular lifestyle change, just that the child should be eating well, more fruits and vegetables, and then staying healthy, exercising more. Yeah. So in Ghana, we have everything. We are equipped. Are we? In fact, let me put it, are we equipped?
Okay, so I'll proudly say yes, we are.
Okay.
So the management of childhood cancer is, it involves a multidisciplinary approach. So that means that you need everybody on board. You need doctors, you need nurses, you need pharmacists, you need laboratory technicians, we need the families, and then we also need the government willpower. So it's a whole like body, like you need a lot of people in play. Now, for our part as medical professionals, yes, we are equipped. We have trained people who take care of children with cancer. We call them pediatric oncologists, and that is what I'm training to be. Okay. So we have people in Kolebu, we have people in Konfanochi, and recently we have people in Rage Hospital, Greater Accra Regional Hospital, in UHAS, and then also we have some people at Cape Coast Regional Hospital. And all these people are equipped in helping people or children with childhood cancer. Then the other thing too is about diagnosis. It's very important that when they come, we are able to make a diagnosis. So we have skilled laboratory technicians and pathologists who are able to help us make a diagnosis once we are suspecting a child has childhood cancer. And sometimes you have to go through the whole hall. So when they come, it's not a simple, straightforward thing. we need to do, so I spoke about the bone marrow. We have to do something we call a bone marrow aspirate. If there are swellings on some parts of the body, we need to go in, take a bit of the tissue, so we call it a tissue biopsy, send it to the lab for them to actually identify what type of cancer it is, because there are different types of cancer which require different treatments. So you need to be very specific so that it will be, that the treatment will be targeted to the type of cancer that a child has. Yes, please.
Okay, so earlier when you were talking about cancer, I asked if any part of the body at all can be cancerous, and you mentioned yes. So the parts where an adult can develop cancer in the body, is the same for children?
Some parts are the same, some parts are not the same.
Oh,
so,
okay.
Yes, so for children, you have the lymphoma, which are the lymph nodes, which adults can actually also have. Okay. And then the leukemias. But then for the retinoblastoma is more common, or let's say it's mainly for children. Okay, and then we have the osteosarcomas. We have something we call the rhabdomyosarcoma that affects the muscle in children. Yeah, so just some types of childhood cancers are actually specific for children. Yes, but you can have lymphoma and then leukemia occurring in adults as well, but they have something we call the chronic type of leukemia. Yes, please.
Okay. All right, viewers. So we are talking childhood cancer, and it's already highly, highly educative and highly insightful. And I hope that you have taken a few notes here and there. And so get interactive with us. We're going to open the phone lines for you to ask your questions. If there is anything that you've noticed in your child, or maybe a relative who is, little, any something that you are detecting in relation to what Doc has said, the symptoms that she has given us so far, you can call in and ask. Doc is here to give you an answer. Before we continue, let me just mention that if you want to go on a diet, some of us, we want to go on a diet to lose some weight, but we don't want to, we want to eat healthy and still enjoy, some very delicious stuff, and one of them is Nutri-Snacks. Nutri-Snacks is here for you. It's very nutritious, and so if you want to go on a diet or you want something to snack on, you need to go for Nutri-Snacks right here. Okay, right, so Doc, let's continue, and now let's come to the treatments. So with what you've said so far, it's making me believe that, treatments is available.
Yes, please.
It's available.
Yes, please.
In the major hospitals here in Ghana.
Please.
It's available. Okay, now take us through, break it down for us and make us understand very, very well. For my viewers out there who want to, understand and know and be satisfied about the fact that, okay, so if I detect these signs in my child and I come to Kolebu, I come to Rage and all that, I am satisfied that, yes, there's a high possibility that something can be done for me. So break it down for us.
Okay, so the reason I'm smiling, so the treatment, so it's one of our main hurdles because of the cost, the cost involved. So we try as much as possible to advocate for people to come and support us because of the cost. Yeah. Because very often than not, our patients who come, the parents, they have a lot of financial challenges. So even though the treatment may be available, sometimes the cost sort of limits them in assessing it, but we try as much as possible at our units to support them. So for the treatments, the number of treatments that we give them, we have what we call the chemotherapy, and those are medications that are given specifically to treat childhood cancer. So that is also the chemotherapy. Then we have what we call radiotherapy. So sometimes the chemotherapy is not enough to cure the cancer, and then we may need to use some beams, which are almost like radiation. So that is the radiotherapy. So we have people we call radiation oncologists who are also specialists in offering that form of treatment. Then we have the surgical management. So I mentioned that you have swellings. So sometimes after giving the chemotherapy.
Before you continue, with the treatments you've mentioned earlier, the ones you've mentioned earlier, is it in relation to the early detection or when it's near fatal?
No, so it's related to treatment of cancer in general. So whether early or late. Yes.
Right.
Yes.
Okay.
So let me just say this before I move on. So in treating cancer, the presentation and then the state at which the child comes will determine whether we are giving the treatment for cure or for something we call palliative.
Okay.
So sometimes we are given for cure because you've come early and then the cancer has not spread. So we are able to cure the cancer and then the child will be cancer free. But when you come late, then we could sort of offer you some form of treatment to palliate, so just to control the disease and then also help manage some of the symptoms that the child may have presented, but not necessarily to cure. So
the palliative and the cure are totally different.
Yes, please.
Right. So
yes, please.
Kindly make the distinction clear for us.
So cure means you are making the person cancer free.
Right.
So that is your aim.
Right.
And that will mean that the child has been presented early to the hospital. But if you don't present early and then you come and the cancer is advanced, has spread to the brain, to other parts of the body, then treating to cure becomes difficult. So we say that we are going to offer you palliative care. So the palliative care means we are not curing you, but then we are just offering you some form of treatment to manage. Let's say if you come and you are in so much pain, we'll manage it. We want to manage maybe the extent to which the swelling is. So we want to reduce it a little so that there is some form of comfort for the child.
Wow.
Yes. So that is why it's imperative that you present very early.
It's very, very important. Anyway, so we have our first caller on the line.
Okay.
Yeah, we are going to continue. Don't worry. We have our first caller on the line. Good morning, Evelyn.
Good morning, Auntie.
Yes. Hey, Auntie. Anyway, so you're calling from Upper West. Yeah, kindly talk to us.
Hello.
Yes, we are listening.
Please, I have a child giving birth to difficulty. He's now 1 year, 2 months. Lifting up the legs is problem. Even the hands, if you want to pick him, to spread the hands to pick is problem. So I don't know how you can help him.
Oh, okay. Doc, please, do you understand what?
No, what did she? I heard bits of it.
Okay, Evelyn, can you please repeat yourself and speak audibly?
Please, first.
Yeah, repeat what you said.
I said I have difficulty in birth. So the child is now 1 year, 3 months.
Okay.
He can't
lift the limbs.
He can't lift his leg, nor hold things to get up himself.
Oh.
Okay.
Oh.
So how am I going to get help?
Okay. All right.
Thank you.
Thank you very much, Evelyn. Please keep watching. Doc is about answering you.
Okay, so for Evelyn, so she needs to go to the nearest health facility so that the child can be properly examined, and then we will assess to know what exactly the problem is.
Okay,
yes.
All right. So there you have it, Evelyn. And so let's continue talking about the treatments.
Yes, so I mentioned the chemotherapy, the radiotherapy, and then we also have surgical management. So if there's a swelling somewhere, we've given the chemotherapy up to a certain level. We'll need to go in and then take it out. So that's where our pediatric surgeons come in. So they'll need to operate on the child and then take it out. So there's a form of surgical management in managing children with childhood cancer. And then very recently too, there is something we call immunotherapy. So that is another form of higher treatment aside the chemotherapy, but it's a bit expensive. Yes.
Wow. So a child is diagnosed of cancer. What are some of the things that the parents, family, what are some of the things they can do to help?
Okay. So I think the very first thing is to present early. And in managing children with cancer, it's not like we are managing malaria. You manage for 3 days and you are done. But then the treatment can span from about 6 months to 2 years. So it's a long haul, and you need the parents to be on board with you. So usually we need compliance from the parents. Like they need to be with us as we treat the child. Sometimes they are coming from very far. So we have people coming as far as from the north, from the Volta, to come to Accra for treatment. And that will mean commuting from that very far distance to the facility. So they need transportation, and we, at our facility, we have a place where we call the Mother's Hostel, where they are housed. So you need them to be actually committed to the treatment. And then for the parents to, it's a lot of emotional stress because they need to be there for the child. So at our unit, we also offer them some form of psychological support. So we need the parents to be on board with us. We need them to be committed to the treatment of the child so that we are able to cure the children.
Wow. Still on the treatment, I've chanced on this quite a number of times on social media. You know, adults who have been through cancer and come out saying they're cancer-free, celebrating and all that, and then, you know, they talk about the fact that, okay, they went through chemo, they are now cancer-free, but then they come back later and say that the cancer is back, it developed somewhere else. Is it same for children that through the treatment, whilst the treatment is going on, what is the possibility or probability that the cancer could develop somewhere else in a child? Okay,
so so for cancer, so there's something we call relapse disease. So it can happen spontaneously. You know, for cancer, we have something we call micro metastasis. So even though sometimes we can do the CT scans, the MRIs to detect the degree of the extent of spread, there are certain spread that are very minute that we may not pick and will be passing through the blood, and it could happen. So unfortunately, sometimes whilst the patient may be on treatment, the cancer could actually recur, and that will mean that the cancer is a very aggressive one. Yes, so sometimes some of the genes are very strong, and then you could have the cancer recurring spontaneously. So that also means that we will need to intensify the treatment. So when it happens that way, the patient is not left just like that. We reassess and then we intensify our treatments.
Wow. So earlier, talking about prevention, you mentioned that, you know, the child eating healthy and then all that. But aside that, is there any other thing or any other things that children could do to prevent all this?
Not necessarily. I mean, for a child, there's very little that they can do. Whatever they do is under the direction of their parents. Yes. So I'll just say that as parents, we should take very good care of our children. We should make sure that they are eating healthy. Like I said, radiation exposure is also one of the things. And then we also try to protect them from infection. So that's basically it, because there's really nothing in particular that is directly linked to children getting childhood cancer that they could actually avoid. Yeah.
Okay. Earlier you mentioned about, you know, government and other people, anybody at all who would be interested in supporting, because yes, it's there, that's treatments and then cancer being cured and all that in the hospitals, in the big hospitals, you know, it's like you're equipped. You would say that you're equipped, but yes, you need more. Yeah. There's more that you need. What exactly do you need?
Okay. So the first thing we need is we need funds, because the medications are costly. For even the diagnosis is also expensive. So we need a lot of financial assistance. The other thing too is we need to train more pediatric oncologists. Yeah. We need to train more pediatric nurses, and that is where our governments come in, because they need to make sure that there are more equipped centers to train these specialists. Then very recently we had the government coming in to say that about 4 of the childhood cancers are on national health insurance. We are hoping that we'll get to a place where all childhood cancers will be enrolled onto the national health insurance so that they are able to access the treatment for free. Yeah.
Let's talk about survival rates. Yeah.
Okay.
I know a lot of them out there want to know the survival rate of childhood cancers here in Ghana.
Okay, so here in Ghana, so for the statistics, I'll say that currently we can have as high as almost close to like 50–60% of childhood cancers being cured if they present early. And then maybe the next time we'll come with 1 or 2 people who have actually survived and then are living their lives after being treated of childhood cancer. So the survival and then the cure rate is very high. It's not as high as the developed countries where they have about 80–90%. We have close to about 50–60% cure rates. But then it all boils down to the presentation. They presenting early. Yes, please.
So at the beginning of the segment, you mentioned that every year we are supposed to record about 1,500 cases of childhood cancers here in Ghana, but that's not the case because we are recording less than that.
Far less.
And it clearly means that the word for childhood cancer is not really out there.
Exactly.
So what exactly is being done about this?
So this is part of it, creating awareness. Very recently, I think last week, on the 15th of February, the day was set aside as International Childhood Cancer Day, and it's all in the bid to raise awareness. In September, it's dedicated as a Childhood Cancer Awareness Month. So basically what we do is we go around the radio stations, the TV stations, talking, educating people on childhood cancer. Also, in our very little space, we try to talk to people around us. We have our public health nurses who go around the communities also to educate people on childhood cancer. We have a palliative care team made up of our nurses. They actually visit the communities and then educate people mainly on the early detection signs, the salient sign that I spoke about, so that people are aware of childhood cancer, and not just making them aware, but making them know that when you come in early, it's curable. Yeah.
And with the early detection, that is not so expensive, is it? If they come to the hospitals and they have to go through treatments and all that, let us know the expense,
the cost. You want to know the cost. Okay, so the cost varies. Because there are different types and then the different treatments. So it can range from about 5,000 to as much as 20,000, 30,000. And this is spread over the duration which the patients will require treatment. For something like acute leukemia, the treatment is for a period of 2 years. So the parent doesn't have to have 20,000 at the beginning of it, but then that is the spread. The cost that they will incur during that period.
Oh, okay. Doc, thank you very much. Before you go, your final remarks on this.
Okay, so my final comment will be that childhood cancer is curable. We need parents, caregivers to present their children to the hospital early, and then we should look out for the early detection signs, the salient signs. So seeking help, ensuring that when you have any eye signs, leukocoria, the whitish spots, you should seek help early. Any swellings is abnormal, please seek help early. Any unexplained fever, any weight loss, kindly seek help early. If there are any body aches, any change in behavior, walk, or any seizures, please present to the hospital, and then we'll do our very best because childhood cancer is curable.
Listen, Anaya, thank you very much. So childhood cancer is curable. Pay attention to your children and make sure that when you notice certain abnormalities in your child, the very important thing or the first thing that you need to do is to seek help. you need to seek help before things get worse. And so, Doc, thank you once again. And so my guest for Good Living segment today has been Dr. Nanaya H.R. Bonney, Pediatric Oncology Fellow at the Kolebu Teaching Hospital and Paediatric Society of Ghana. Thank you once more. And so, viewers, this is where we end a Good Living segment right here on Prime Morning. My name is Esia Dwakumi. I hope you've learned a thing or two. And just to remind you before I go that Nutri Snacks is here for you. So for those of you that want to enjoy some deliciousness when it comes to nutritious snacks, Nutri Snacks is here for you. Oh, nutritious snacks, Nutri Snacks. There you have it, right? So get you some Nutri Snacks and enjoy. And yeah, like I mentioned earlier, if you are you're on diet and then you want to still eat deliciousness, something very good, you can go for Nutri Snacks. And so that's it right here on Good Living segment on Prime Morning. My name once again is Esiedua Akumia. Coming up next, I love this young lady that is, going to be interviewed today. I love her so much. I love her music. I'm ecstatic about this conversation, and I can't wait for what she has to share with us. And so do stay tuned. Coming up next is entertainment segment right here on Prime Morning. We'll be right back.